Well, I was born with cystic fibrosis. It runs on my dad's side of the family. I knew that there was a limited lifespan with this, and you know, I wasn't sure what the options were beyond that when that time came. I just turned 25 when Dr. Biller, Dr. Julie Biller, who was my CF doctor, had told me that I needed a lung transplant.
Mr. Dietz presented to our program from our adult cystic fibrosis program. His lungs and his end-stage lung disease were going to preclude him, from achieving the goals that he had really set out for himself along with his family when he was younger. Lung transplantation among the different, solid organ transplants is probably among the most challenging. It really is a therapy you offer to other patients when they have advanced lung disease, limited survival potential, and also you don't have other medical therapies that offer them the promise of enhanced survival.
Right before we got married is when we kind of knew that transplant was going to be his future.
It was an amazing transformation, really. I mean, to go from not to being barely able to breathe to having 100% lung function almost immediately was an unbelievable experience.
We did our first lung transplant in 1991 and have done 94 transplanted patients since that time. We have many long-term survivors that are upward of 10 to 15 years and people that have had normal lifespans. About 60% of them are still alive after 5 to 6 years or more after their transplants. Survivals have been excellent with 1-2-year survivals in the 90% range. Those are very comparable to national statistics. You have to remember that these are patients that otherwise might not have had a chance of living even 2 years without the transplant.
Do you remember the big owie here? And you would always touch me and say, "Does it still hurt, Nana?" Do you remember that? I had no idea how sick I was. It creeps up on you. You were sick for a long time. You don't even realize how much muscle loss there is. You don't realize how your breathing is deteriorated. You don't realize, fatigue becomes normal. Later on is when it hits that this is really serious and that you also have a chance.
Typically we get anywhere between 2 and 5 referrals per week. Out of those referrals, maybe 25% will actually come through for a full evaluation. We try to be very supportive of the patient, provide them with all the tools that they need to benefit their mental and their physical well-being throughout the process, because it can be a very stressful time, especially with that, that not knowing whether or not they qualify until we actually meet with the medical review board to determine their candidacy for transplant. Then the next step is that the patient would be put on the UNOS waiting list. The national average currently is about 6 months of a wait time. The good news is patients are listed by how sick they are.
Lung transplantation is still a difficult therapy. Clinical excellence has taken it to a certain degree, but you're really going to need research breakthroughs in order to improve the outcomes and survival.
This is the kind of care that is best provided at an academic medical center. This is where clinical trials that have new drugs, new therapies, new surgical interventions can be offered.
If you're not in an academic setting where you have the full support, the educational component, the research component, it's really difficult to stay up to speed in providing those patients the absolute best care possible.
There are no other lung transplant programs in southeast Wisconsin, so it was important that the lung transplant program at Froedtert and the Medical College of Wisconsin was available and sustained.
Many of our transplant contracts in the country do have not only minimum quality, but also minimum volumes every year for transplant.
It makes it hard to support a small program when everybody thinks that large is the only measure of quality.
And so it was the faculty that impressed upon me the need for us in Wisconsin, southeast Wisconsin, to have this program, to have it available for our patients. The investment that we made in the lung transplant program allowed us to get Medicare certification, which we had not had previously.
If you're not CMS certified, other payers, other insurers, large networks across the country that generally pay for transplant will not pay at your center. The vision is to grow the program overall, make sure that each of our organ programs is hitting the minimum requirements in terms of volume and quality to participate in the national payer networks.
So I think it really speaks to what we have here at Froedtert and the Medical College to be able to really provide the physicians and the specialists who can do this kind of work, who can do it routinely, who can do it in an excellent fashion and have outstanding outcomes with this.
We do it all on this campus, adult and pediatric. Every organ, just call us. We will take care of your patient.
What's most rewarding is the kind of result that Millie and many of our other patients have, where they're able to get out there, live free, good quality life.
I have lots of opportunities to go other places, but I never will. If anybody has a doubt about where to go, I think this is the place to go for a transplant.